Madison Johnson, 02/10/2000.
Okay, can I also see your wrist bracelet, please? Okay, say that it matches. Very nice. Okay, let me go ahead and close the curtain for privacy, okay?
Okay.
Okay, and then we're going to be doing a head-to-toe assessment on you, okay?
Okay.
I'm going to be palpating and listening to and tapping your body parts to see if there's anything wrong or see if there's any issues with you, okay?
Okay.
Do you need to go to the restroom before we start?
I'm okay.
Are you in any pain before we start?
No pain.
Okay, awesome. I'm going to go ahead and inspect you really fast and note that like you have hygiene and that you're conscious of what's going on. Do you know what today is?
Today is Thursday.
Okay, and then what are we doing?
We're doing a head-to-toe assessment.
Okay, and where are we?
We're in the doctor's office.
Okay, perfect. I'm going to go ahead and wash my hands, okay?
Okay.
Okay. Go ahead and wash my hands. Okay, all right. Hands are washed. We're at this time also going to get your weight and your height, okay?
Okay.
And I'm also going to be doing your vital signs. So your pulse, your blood pressure, your O2 saturation, your temperature as well, okay? And your respirations.
Okay.
Okay, perfect. Okay, any questions before we start? Okay, and if you need to take any breaks, let me know when you need to, okay?
Okay.
I'm going to go ahead and start with my gloves. Okay, I'm going to put some gloves on. If you want to put your arms down to your side, are you comfortable?
Yes.
Okay, awesome. I'm going to begin with palpating your head and checking for any lesions and any lumps, okay?
Okay.
Okay. Everything looks good. I am noticing there's good hair distribution and I don't see any lice and there's no lumps, okay? Alright, I'm also going to be working down to your face now, okay? Okay, so I'm just going to be feeling your facial bones and I'm going to be palpating your frontal sinuses, your maxillary sinuses, and your lacrimal glands. You go ahead and open your eyes for me and then look up. I'm going to be looking at the sclera and the conjunctiva of the eyes. Okay. Let's see. I'm feeling the eyebrows and I'm also seeing that they're evenly distributed with hair, okay? I'm going to go ahead and start with your eyes. Okay, awesome. I'm going to go ahead and lay out all my supplies on the table. Okay, and then before we start, I'm going to go ahead and have you look at the wall and go ahead and look at the Snellen chart. If you were to have glasses, you're going to do this with glasses first. Okay, so then just go ahead and look at the bottom line and read as clearly down as you can.
G, F, K, L.
Okay, awesome. And then go ahead and cover your left eye and do the same.
J, F, K, L.
Okay, and then the right.
J, F, K, L.
Okay, perfect. And then if you did have glasses, you would do it without the glasses now, okay? Perfect. So I'm going to be testing your eyesight right now.
Okay.
Let's see. I'm going to be testing your nerve vision. So if you could just look at my ID badge and read what it says.
Student Registered Nursing, Hannah.
Okay, and then cover your left eye. And you do it again.
Student Registered Nursing, Hannah.
Okay, and then your other eye. Your left. Right.
Student Registered Nursing, Hannah.
Okay, perfect. All right, then I'm going to be testing your pupil response to light, okay? Just go ahead and look straight at the wall. Okay, and then now this side. Okay, perfect. And I'm going to be checking your corneal response to the light as well. In the middle of your forehead and or in the middle of your eyes, and then the corneal light response is equal in both, okay? Okay. So now I'm going to go ahead and test your accommodation by holding this, and then you're just going to focus on it as I bring it closer to your face, okay? Perfect. And then I'm also going to be testing your motor nerves of the eyes. Just go ahead and look at the pen without moving your neck. Go ahead and just follow the pen with your eyes. Okay, perfect. Alright, and then I'm going to go ahead and have you cover your left eye. Okay, I'm going to cover my left eye with my left eye with my right hand. Okay, and then just tell me when my hand comes into your visual field, okay?
It's up there.
Okay. other side. Okay. Perfect. All right. So, let's see. Any pain or anything with that? Nope. Okay. Awesome. So now we're going to be working to your ears, okay? I'm just going to go ahead and have you look slightly to the left. Okay. I'm going to go ahead and look into your ear. Okay. Put your hair back. I'm going to lift the auricle up and back. I'm going to look into your ear. Okay. I don't see anything weird. I'm also going to palpate your ear. And you can put your head towards the middle again. And I'm going to be doing it on both sides. Okay. I'm noting that your ears are pierced. I'm also going to be performing some hearing tests, if that's okay with you. Alright, so I'm going to be using this tuning fork, okay? And I'm going to be putting it in the middle of your forehead. Okay, so I'm going to tune it, and then you tell me if you can hear it equally in both ears. Okay. Yes. Okay. Next, I'm going to be putting it to your process in the back of your ear, okay? And you just tell me when you can't hear it anymore, okay? Okay. She will be putting it at the mastoid process, sorry. So I'll be doing that in both ears at the mastoid process first. Okay. And then I will be doing bone conduction and having it away from your ear a little bit, okay? Okay. And then tell me when you don't hear it. Okay. Okay, perfect. And I'll be doing that in both ears. I'm also going to have you do a test for me. If you want to put your right finger in your right ear and go ahead and wiggle it back and forth. And then I'm going to say some words and you're going to repeat them back to me, okay? Okay. Cat is tiger. I'm going to try again, okay? Good. Can't talk tiger. Okay, perfect. Alright, so I'll be doing that in both ears. Alright. Any questions about that? Okay, now I'm going to be moving on to your nose. Alright, so I'm just going to be palpating it first. I do notice that you have your ear pierced, or your nose pierced. I'm going to check for nose patency. I'm going to go ahead and hold each nostril and you're going to breathe in through the other nostril. Okay. Okay, awesome. And then I'm going to be going ahead and giving you something to smell if you want to close your eyes. Okay. Okay, and just give me, and then just tell me what it smells like. Cookies? Okay, perfect. Okay. Any pain with that? Okay, now we're going to be moving down your mouth, okay? Okay. So I'm just going to inspect the lips. Can you give me a smile? Okay, I am noticing that the teeth are orderly and then the gums are nice and pink. Can you go ahead and open your mouth for me? Okay, I'm noticing that the tongue is wet and the soft palate and hard palate are also nicely circulated. Okay, and then if you want to say ah. Okay, I'm noticing the uvula going up and I'm noticing the oral pharynx. Okay, and then I'm going to go ahead and test your gag reflex, okay? Okay. Okay, perfect. Okay. All right, so now I'm going to be moving on to your neck, okay? Okay, so I'm going to be feeling around your neck. Okay, I'm going to feel for your carotid artery on each side one at a time. Okay, perfect. I'm going to feel for your lymph nodes in your neck, okay? Okay. So I'm just going to go. Okay, perfect. Alrighty. So I did that. Now we're going to go ahead and test range of motion, okay? Okay. So if you want to just look to each side, the left and the right. Okay, and at this point, I'm going to notice the jugular distension. Okay, and then look the other side. Perfect. And then if you want to put your ear to your shoulder on each side. Okay, opposite. Okay, head back up in the middle. I'm gonna have you do it again, but I'm gonna have you do it against pressure, okay?
Okay.
Okay, so go on this side. Perfect. Okay, now on this side. Okay, awesome. And then I'm gonna have you put your chin to your chest. Okay, and then I'm gonna be removing the pillow behind your neck, okay? Okay, and then go ahead and look up. Perfect, okay? I'm gonna put the pillow back under your head. Is that comfortable?
Mm-hmm.
Okay, awesome. Alrighty, so I'm also gonna be feeling for your trachea. If you can put your head up a little bit. I'm gonna be feeling for your trachea. And your gland as well. It's not enlarged. If you can give me a swallow. Okay, perfect. I notice that it's in the center of the throat. Okay, perfect. I'm gonna go ahead now and auscultate your carotid arteries. Okay. Okay. Okay, I'm gonna be using the bell of my stethoscope. Okay, if you want to look slightly this way. Okay, other side. Okay, I didn't hear any bruise or anything or any weird sounds. Okay, so I believe that is it with your neck. Oh, I did forget something now that I think about it. I'm gonna have you do some facial motions for me, okay? To test your cranial nerves, okay? So can you go ahead and clench your teeth? Okay, and then grind your teeth. Okay, stick out your tongue, puff out your cheeks, and then wrinkle your forehead. Okay, and then what I want you to do is close your eyes. Okay, I'm gonna be touching a soft piece of paper to your face, and you just tell me when you feel it. Okay, perfect. Alrighty, so sorry about that I forgot that. So I'm gonna go ahead and now do your chest. Okay. Perfect. I'm actually gonna go ahead and check out your shoulders. Okay, so I want you to raise your shoulders against pressure. Okay, and then I'm gonna go ahead and do your arms. I'm gonna go ahead and raise your blanket down a little bit. Okay, perfect. And then I also forgot one more thing. I just thought about it. When I was assessing your face, I forgot to palpate your mandibular joint.
Okay.
If you want to go ahead and open your mouth and close it a couple more times. Okay, any pain with that or anything? Okay, sorry about that as well.
That's okay.
Alright, so if you want to put your arms out like this. Okay, I'm going to be feeling for muscle mass and noting any bruising or skin discoloration. I'm also going to be feeling for your pulses, so I'm going to be doing your radial and also your brachial. And I'm also going to palpate your epitrochlear nodes on each arm, okay? Okay, and then if you want to hold your arms out in front of you and then rotate them, okay, and then flex up your wrists and then extend your wrists and then do a wave. Awesome. Any pain with that? Okay, awesome. I'm going to go ahead and have you lift your arms up as high as you can. Okay, and then put your arms out to the side. Okay, and then put your arms out in front of you again. Okay, I'm just going to test for your resistance as well. So go ahead and try to move them up and then try to move them down. Okay, perfect. And then put your arms out this way again. Okay, I'm going to go ahead and do the same thing. Okay, up, down. Perfect. Okay, awesome. Alrighty. Arms look good. Now I'm going to go ahead and assess your back. Okay, so can I take your blanket off for you? Okay, if you want to go ahead and swing your legs over for me, please. Okay, I'm going to go on the back side of you, okay? Okay, so I'm just going to go ahead and check out the back for skin marks, lesions, bruising, kind of the overall inspection of muscle mass and the way that the skin looks. Okay, I'm also going to do a general palpation, feeling your shoulder blades and kind of feeling down. Okay. perfect. And now I'm gonna be doing some lung sounds on you, okay?
Okay.
So if you can just give some deep breaths when I move my stethoscope.
Okay.
Okay? Okay. Very nice. Perfect. And now I'm just gonna go ahead and auscultate that as well, okay?
Okay.
Let me know if you feel any discomfort. Okay, so I'm also going to go ahead and palpate, or sorry, percuss your spine, okay?
Okay.
Okay. Okay, perfect. And then I'm also going to be testing the from Midas.
Okay.
So it's just the vibrations of your voice when you talk on your back, okay, in your lungs. Okay. So I'm gonna go ahead and put my hands down. If you want to say the number 99 as I go, okay?
Okay. 99, 99, 99, 99, 99, 99.
Okay. Alrighty. I'm also going to be feeling for the 10th rib for thoracic expansion. Okay. Okay. Perfect. And I'm letting the diaphragm moving up and down when you breathe, okay? I'm also going to be feeling for any discomfort with the kidneys, okay? So just let me know if you feel any pain, okay? Okay, alrighty. Was that okay for you?
Mm-hmm. No
Okay,
problem.
awesome. I'm gonna go ahead and have you lay back down for me, okay?
My back or
Yes, please. Yep. I'll cover you up another little bit. Okay, now I'm going to be listening to your lung sounds in your chest, okay? Okay. Okay, ready? Sorry. Perfect. And then I'm going to go ahead and have you lift up your right arm. Okay, and I'm also going to auscultate on your right side for lung sounds, okay?
Okay.
Okay, perfect. I'm now going to go ahead and auscultate your heart as well, okay? Okay, perfect. So I'm going to start at the aortic pulse, okay? I'm going to go to the pulmonic, the second pulmonic, the tricuspid. Okay, and if you can go ahead and kind of raise up your left breast a little bit, okay, and then move your hand a little bit. So this is going to be the mitral or the apical pulse, okay, and that's also going to be your point of maximal pulse, okay? Okay, that everything sounded great. I didn't hear anything weird or anything. Let's see. Okay, I'm going to go ahead and work my way down to your abdomen now, okay? Okay, so first things first, I'm going to do a general inspection.
Okay.
Skin looks fine. Skin is nice and tight, okay? First I'm going to be doing the general inspection, and then I'm going to go ahead and auscultate, okay? And this is for any gurgling sounds or any bowel movement sounds, okay? Okay, I'm going to be starting in the lower right quadrant. Okay. And if I didn't hear anything or heard anything weird, I would be doing that for 5 minutes, but just for everything is normal, I will be doing it for a minute. Okay, so I did that for a minute. I'm also going to be auscultating your large arteries in your abdomen. Okay. Okay. And I'm going to be using the bone my stethoscope for this. Okay. So this is going to be your aortic, your renal,